We presented the results of the first phase 1/2 pediatric trial of Dabrafenib. It's a V600E BRAF inhibitor for children specifically with low-grade gliomas that possess that mutation. The results were really exciting. This is really the first trial where we've taken a targeted therapy specifically for this type of brain tumor. Children with that specific mutation, we worry, have a much worse prognosis than even the typical tumors of that type. And the responses that we observed in the trial, virtually every patient either stopped growth of the tumor or had shrinkage of their tumor, which was actually quite dramatic. One of the advantages of pediatric patients is they haven't been out in the sun for the last 30 or 40 years, so they lack the skin exposure that's thought to be the kind of secondary event that triggers the squamous cell carcinoma in adults. So actually in the clinical trial, we actually didn't see either any cases of squamous cell carcinoma or the eye abnormalities that were frequently associated in the adults. I suspect over time it's likely we will eventually see them as we find children, particularly the older adolescents that have been sunbathing more and more, something that's becoming more popular, but as of yet we haven't seen a single case. Right now the treatment is for relapsed and refractory patients, and actually the therapy has been so much better than what we've been seeing with the more standard chemotherapy approaches that actually there's a proposal now to move this into an upfront setting instead of making the patients wait to relapse on chemotherapy. We're trying to move particularly away from radiation therapy that damages the developing brain. So this is exactly an opportunity in patients with the right mutation to get this therapy in early. The one kind of caveat is, although the responses have really been dramatic and exciting, we don't have 30 or 40 years of developmental knowledge, and you always worry about what some of these drugs could do in the long term. So there's still some things we need to know, a kind of caution as we move forward. It's kind of a mix. Actually, in this particular tumor type, following the adult series, where the BRAF inhibitor had a lot of activity, but when added to the MEK inhibitor, which is the pathway just below, when you hit both of them together, you do two things. You seem to improve the activity, the response rate in adults with melanoma, as well as the longevity of the response, both important components, and actually you reduce the toxicity of the drug because the second drug actually inhibits some of the toxicity formation of the first. So in adults, the standard combination is now the dual, and in fact, that's exactly what we're in the midst of doing now. We've tested the first drug, and those are the results we reported. We've now completed the testing of the second drug, and we'll be reporting those results soon, the MEK inhibitor. And now, actually, we've already started the MEK plus Dabrafenib clinical trial to see, again, if we can't even improve on what was already a pretty exciting result.